The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm here with Lou Rubin, who's the professor of medicine at UCSD, my own institution. And Lou is internationally renowned for his work in pulmonary hypertension. There's been a lot of new developments in the field of pulmonary hypertension, and actually these are coming forth as two publications in JACC. One is the Clinical Expert Consensus document, and the other one will be a supplement, a wonderful supplement, the Proceedings of the Fourth World Symposium on Pulmonary Hypertension. So Lou, perhaps you could summarize for us some of the important developments in the field.
Sure, Tony. There are some important components in the current soon-to-be published document, the CECD, highlighting clinically relevant material for the cardiologists in particular, dealing with diagnosis and management of pulmonary hypertension. In particular, the role of echocardiography in diagnosis and following patients with pulmonary hypertension, the benefits and the limitations of echo.
Do you think we're relying a bit too much on echo?
I think so. I think there's an over-reliance on an estimate of pulmonary artery pressure by echo alone, both to diagnose and to follow patients, and we know that there are many other aspects that are more important than that measurement alone by echo, and that's discussed in great length in the document. There's a component on probably the most common form of pulmonary hypertension seen by cardiologists, and that's PH due to left heart failure. What's known, what's not known about management of that condition, some of the future directions of managing that condition in particular.
Any new things we should be doing right now over and above the standard treatment of left heart failure?
Well, there are some interesting developments still in the early stage using agents that address the nitric oxide pathway like phosphodiesterase inhibitors, potentially guanylate cyclase activators that may be very useful, not just treating the pulmonary hypertension component, but the left-sided component as well. And that's work in progress, but this is a very important aspect of management of pulmonary hypertension for the practicing cardiologist in particular.
And one we'll keep our eye on.
The other is chronic thromboembolic disease, a condition that we're certainly attuned to here at UCSD, and an emphasis on always looking for that condition in a patient with suspected pulmonary hypertension because its management is so very different from the management of other forms of pulmonary hypertension.
And the best screening technique that you would recommend?
It's still the simple ventilation perfusion lung scan. It's a really good test for that disease.
Right. And new forms of therapy for pulmonary hypertension?
Yes, that's been one of the areas of greatest advance over the last decade or so, or the development of targeted therapies for pulmonary hypertension. And it's important for the cardiologist to know that the drugs that we use for this disease are very different from the drugs they use for other forms of heart disease. And there are complexities in terms of choosing which therapy, timing of therapy, and so there's a good deal of guideline and algorithm for how to choose therapy for pulmonary hypertension based on disease entity, disease severity, and then how to follow patients on therapy with pulmonary hypertension, what parameters to use to follow them, and when to choose alternative or additional therapies.
Yeah, well, I've had the opportunity to look at some of these documents, and they're really excellent. There are new agents out there, and there are complexities, and they're spelled out very well, and I think we're able to do a lot more for our pulmonary hypertension patients than we used to even 5 or 10 years ago. Thanks a million for being with us, and for the Genuine Article, I'm Tony DeMaria.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.